My name's Teri Dreher. I'm a registered nurse and professional patient advocate from Chicago, Illinois. My background of my nursing career was somewhat circuitous. I started out as an intensive care nurse, and I practiced that for about 39 years. And in the US, we started a new form of healthcare in 2010, 2011 called the Affordable Care Act. And when I saw a lot of the changes coming down the pike, I knew that people out in the community were going to need a little extra help because it was getting so complex. So I started my professional advocacy business, Northshore Patient Advocates, in 2011. And honestly, it's been the best career decision I've ever made. I decided to start my own business in 2011 when I just saw that people were struggling with the complexity of modern healthcare. And I also had a couple of experiences in my personal life that really impacted me. The first was my father-in-law, who was the family patriarch, had taken the entire family on a cruise to celebrate their 50th anniversary. And during that cruise, he developed a medical calamity. He clotted off a little filter in his aorta that had been placed there a few weeks earlier to catch blood clots so that he wouldn't have a stroke or a heart attack. So he fainted on the cruise ship. And when I went to pick him up at the stateroom the next day, I could tell that something was seriously wrong because his legs were all swollen up and starting to turn purple. And I took him down to the ship's doctor, and interestingly enough, the ship's doctor was from South Africa. And we consulted outside the room after he had examined my father-in-law. And I said, I think he's clotted off his IVC filter. And the doctor said, well, that's true. We don't have any diagnostic equipment on the cruise ship, so I'm going to advise that you get him off the ship and take him to this little hospital. We were off the coast of Belize in the Caribbean at the time. He had a 4-hour procedure. He had essentially had clots from his thighs all the way down both his legs and up to his diaphragm. And over the next 6 weeks, my father-in-law had multiple near-death calamities. Patient advocacy means many different things to different people. You can be an advocate for a special interest group. You can be a political advocate. But as a nurse, patient advocacy to me means that you are the frontline person protecting the patient. You're the one that's filling all the gaps in modern healthcare. You're the one that's looking down the road at the landscape of what they're going to face in the future. You're the one that's there to prevent them going back into the hospital needlessly just because they don't have any caregivers. And in the US, we have an awful lot of people called senior orphans. Those are people whose families are on the other side of the country, or perhaps they never got married, never had any children. So they're aging alone, and they're greatly at risk as they age and develop cognitive impairments and physical complex comorbidities. They really do need a nurse advocate. And it's growing in awareness all over our country over the past 12 years. And I just think that somebody with a medical background to stand next to the patient, holding their hand and helping them not fall through gaps that can be dangerous is my definition of advocacy. We're the gap fillers. We're the ones that do everything else that so many people in healthcare today are saying, that's not my job. Northshore Patient Advocates is the largest and highest skill level professional patient advocacy in the Chicagoland area. We were the first professional patient advocacy in Chicago. We formed in 2011. And because I'm a former ICU nurse, I always wanted to attract very complex, very ill, very vulnerable patients. So I have 7 nurses and 1 physician who work for me as a professional patient advocate. And then I have 3 office staff. I have a chief operating officer, a director of nursing. I just hired another nurse yesterday. And we're growing and expanding all the time because there's just a growing need right now. I do have a third program that's actually underneath the umbrella of Northshore Patient Advocates, and that's called Nurse Advocate Entrepreneur. And that's a digital online course that people pay me to take a digital course on how to start your own business as a patient advocate, because again, a lot of nurses are looking around for something different, something more rewarding than working in hospitals. But we do have students every time we offer the live online class. So I'm happy with that. I want to help nurses hit the road running and avoid a lot of the mistakes of the new entrepreneur. Really has. I was one of the chair people for the International Conference on Patient Advocacy in Chicago. We held that just a few months ago at the end of April. And we had people come from all over the world to that. And we see a growing interest in patient advocacy, particularly during COVID. I think if COVID has taught us nothing else as healthcare consumers, it's taught us that if you don't have somebody to advocate for you, then you're really at risk with the new fast-paced form of healthcare. In terms of the growth of patient advocates in the US, when I first came into this field in 2011, there were about 563 professional advocates in the country. Right now, there are about 2,700 that are registered. There are probably a lot more out there that are practicing that are not registered with one of the organizations. And there is a board certified patient advocate credential out there. And most of the very serious professional patient advocates do go on the Patient Advocate Certification Board website and sign up and take the exam, because we do, since 2017, have a national credential to certify people as board certified patient advocates. Well, I guess the short and simple answer is that in the US, you really cannot talk about health and long-term health care without talking about money, because a lot of people do not plan for retirement. They just assume that they're going to die early and not need to have any long-term care money set aside, but it's expensive. I'm not going to translate it into rands or anything, but in the US right now, where I live, the average cost of a skilled nursing facility for somebody for long-term care is about $10,000 a month. For an assisted living facility, it's around $6,000 to $7,000 a month. So if people have run out of all their money completely, then it's a complex process to try to get them on Medicaid. And Medicaid is a long application process, and it's complex, and the government is looking over everything, because they're not going to pay for pensioners' long-term care if they still have money. So you have to have less than $2,000 worth of liquid assets to be able to qualify for Medicaid. So I get involved with a lot of legal things and have to learn a lot about the financial side too. Sure. I actually feel that we do as much good for the families as we do for the patients. This last week, I got a call from a woman whose husband has late stage dementia, and he was in a terrible skilled nursing facility. And she was just distraught. Nobody would listen to her about everything. So within a couple of days, I was able to come in and do all of the complex management to get him out of there. And we brought him home under hospice care. I got a really good hospice organization out there, and he got home yesterday, and her anxiety level has just gone way down. So families are so emotionally distraught by the complexity of US healthcare and the emotional side of watching their loved ones just deteriorate before their eyes, that I think when we come in, we bring the drama down for everybody. The patient often is so sick they don't even realize how bad things are, but the families of elderly patients are just overwhelmed, lost, and confused. They're worried about money, they're worried about legal things, they're worried about everything. We provide a lot of valuable referrals. We bring in sources for funding. Yesterday, I was able to talk to the Veterans Administration, who will provide 16 hours a week of caregiving services for this man, so the woman doesn't have to care for him all on her own because there are limited funds. And yeah, just really, really sad. This man was a corporate attorney, but as his dementia grew, he made some really bad financial decisions that resulted in over half of their life savings being lost. And so the woman is dealing with anger, grief, fear, and everything. And yesterday I could just see she's relaxed. She knows that I'm going to handle the more difficult parts. And so I think the value we provide to families is every bit as important as the protection we provide to patients. Well, mostly in the healthcare industry, I just want to keep growing awareness that we're a valuable resource. I'm doing a lot of virtual Zoom meetings with care managers in hospitals and showing them that RNs can make a huge difference in reducing hospital readmission rates. In the US, every elderly person that gets discharged and comes back within 30 days, it costs the healthcare system, that hospital, $16,000. And so if they refer more clients to us, they're going to save more money for themselves. And so I just want to continue to raise awareness and show them that we're not scary. We understand the pain that they're going through. We want to help. And it's just, they're so used to doing things in a very textbook algorithm sort of way. It's hard for me to talk to them about doing things in a new and different way. So that's what I'd like to do more, is to get more hospital referrals and just get people to think outside the box a little. Get educated. For people that want to be a better advocate, there is so much information out there. I get interviewed all the time in newspapers. I have a newspaper column. I'm on the radio. I do podcasts quite frequently, spreading the word. But I think there are a lot of good books out there that you can educate yourself about your healthcare system, find out as much as you can, ask a lot of questions. I tell family members and patients, always take along a little book. Every time you go to the hospital, a little notebook. Every time you go to a doctor's appointment, write down everything the doctors say so you don't forget. You think you're going to remember, but you won't, because people are nervous in hospitals and doctors' offices, and they're sick and they don't forget. And sometimes just having another person along that can hear things and write things down for you is enormously helpful. I would also say always be very polite and thankful. Today's healthcare practitioners are overworked, understaffed. They don't have the time that they used to. So be a smiling presence and thank them for everything. And if you're unhappy about something, ask with kindness and just be persistently, pleasantly firm.